Hi, it's Dr. Bob Dannenhoffer. I'm kind of talking about a little louder here. We're having a little bit of technical issues. Public Health Officer for Douglas County. This is another of our Facebook Live events. This is our chance to answer your questions and to do it locally. We've been doing this now for well over a year. And so if you want to put your questions in, do it at Facebook questions at douglaspublichealthnetwork.org. That's the best way to do it because it gives us a chance to do some research beforehand and get the answers exactly correct. Or you can put them in the chat section and we'll do the best we can as we get to them. As always, we start at the world level and then move down to the local level of how things are going. It's been a really hard week. In the world, cases are rising and deaths are rising. This now is the summertime in most of the world, and where most of the people in the world live. And there are hotspots almost everywhere. North America, the US and the Caribbean is really hot. In South America, it's a little less hot than it was before, but still lots of disease. There's a bunch of evolving disease in Africa, and Africa has been my greatest concern overall. Africa starts off with almost no vaccinations, a very low level of previous infection, so not very much natural immunity, a lot of immunosuppressed people from untreated AIDS, and a terrible healthcare system. And so they start off not with the ancestral forms that will take a while to mutate. They're going to start off with Delta. And so they're already starting off with a really nasty variant, and it's only likely to get worse in Africa. So I worry about Africa. Europe is still a concern, although to the good, the number of cases in the UK is coming down. They've had about 3 months of a terrible time with the Delta variant. It does look like it's coming down now, and that's a good thing. But there are some good places. Taiwan still less than 1 case per 100,000 per day. South Korea just hit 3. Norway just hit 5. Canada is still at 1. So there are a bunch of places in the world that have low levels. And the places that have low levels have a combination of relatively high vaccine levels, and they're still doing some public health measures. In the US, it's a mess. Cases are way up, deaths are starting to go up, and we're seeing this crescent starting in Missouri, moving its way down through Arkansas, then to Louisiana, now in Alabama, Georgia, and Florida, just having huge rates of disease and high levels. So they talk in Florida about having the highest level of cases and the highest level of hospitalizations they have ever had. And that really is very worrisome. Oregon is similarly worrisome. We're having a real increase in the number of cases. We're averaging over 800 cases per day down. We were just a few hundred a few weeks ago, and now we're well over 800. And we're seeing especially disease in Umatilla, Josephine, Jackson, Douglas, and Curry counties, all places with relatively low vaccination rates, but there's probably more to it than that. There's also almost certainly the introduction of the Delta variant into these areas that's causing the trouble. Well, Douglas County has just had a horrific week. Before this week, our highest number of cases today was 41. We had 91 cases today. Our previous high for hospitalizations was in the low 20s. We have had 25 today. We have 3 deaths over the night. We've had now 6 deaths in the last 3 days, including somebody who's 43 years old. In the hospital, half of the beds in the ICU are filled with COVID patients. And we have 2 people in their 20s and 1 in their 30s on ventilators. So as much as young people say, I get disease, I'll be fine, you are not fine if you need to be on a ventilator. You are not fine if you die. And so this is really worrisome. And I think when we look at this, we've had probably 5 separate introductions of the Delta variant, one from a group that traveled to Arkansas, one from a group that traveled to Alaska, one from a group that traveled to California, and 2 suspected introductions from a group that traveled to Oklahoma and another that traveled from Arizona. So I think what we did is we got hit with a bunch of introductions at one time, and cases have really taken off. We look now, we have a number of really large outbreaks in businesses, at the jail, at healthcare facilities, in churches. It's just all over that we're seeing these cases, and the cases are coming in so hot and heavy. It is just hard to believe that we're this far into it and having this many cases. So I think the Delta variant is clearly the issue, but we are also having very little public health measures. I don't see very many people wearing masks or taking other precautions, and we have a relatively low vaccination rate. So you put all of those things together, we are really ripe for this. Now, this should come as zero surprise, absolutely zero surprise for anybody who has watched this. 10 weeks ago, when Missouri was starting to heat up, we talked about Missouri and Douglas County having some of the same characteristics of not a lot of public health measures and no mask wearing. And when we saw that Missouri was starting to heat up because of the Delta variant, we said there's absolutely no reason it couldn't happen. And just as bad here in Douglas County, and now 10 weeks later, is happening in Douglas County, and just as bad as it happened in Missouri. The bad news is Missouri is in this already 10 weeks, and they're still having an increased number of cases. So it's really, really worrisome for what it looks like for us for the rest of the summer and the early fall. The good news is we have the vaccine, and the vaccine is good. Now, it doesn't work as well against the Delta variant as it did with the previous variants. So with the previous variants, it was well over 90% protective in protecting you against disease, and well over 95% effective in preventing hospitalizations and deaths. So it was 90% for disease, 95% hospitalizations and deaths. Against the Delta, it's probably in the 70s or 80s against protecting disease, and probably only in the low 90s in protecting against hospitalization. But still, 90s is pretty good. I mean, most of the vaccines we have out there would love to be as good. So, for example, the vaccine we have against pertussis, or the vaccine that we have against pneumococcal disease, is not nearly that good. Flu vaccine is much less good. So the vaccine is still pretty good, and we have a lot of vaccine, a lot of places giving it, so we're really encouraging people to do that. Okay, so let me get to the questions here. So Susan says, I know we are tracking breakthrough infections in people who have been vaccinated. However, as a person who has had COVID in the vaccine, I'm wondering if you've seen any cases of COVID, especially the Delta, in this population. So this question is, what about the natural immunity? And so natural immunity seems to be maybe not quite as good as the vaccine, but still okay. Yes, we have seen some people with secondary cases. So they had a first case in November, whatever, and now they test positive and are sick again. But just like the vaccine, natural immunity is good, but certainly not perfect. And so if we just said, well, let's just let everybody get the disease, they'll get it once and then they'll be done with it. That's not the case, because we just know, like, the vaccine isn't perfect, nor is natural immunity, so you could have people get it again and again. So someone says, I'm a senior that received the Moderna vaccine in February and March because of my age, 85. I'm concerned that my antibody level has decreased and that my protection against the Delta variant is not adequate. I'm particularly concerned because I am required to do some long-distance travel in September to have an option of receiving a third vaccine to boost my immunity. I know that the CDC has not yet recommended booster doses, but can I opt for one? So this has been one of my biggest problems this week, is that she's exactly right that with time, the antibody levels go down a little bit, especially if you're old, and especially against the Delta variant. So there's been a lot of talk about doing a booster, and it's been very confusing. It's because the company says you should do it. There are studies that are saying you should do it. Germany and Israel are doing it. I read today in the news that a hospital in San Francisco is doing it, all based on just shoddy data. I really, 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 really wish that the CDC and the FDA, who has this data and can get the actual data, will actually make a recommendation. I think boosters probably make sense, but I think you want to do it according to some recommendation. Which is the one, when you should do it. So if you got the Moderna, should you get a booster of the Moderna? Should you get a booster of a different vaccine? When should you get it? Is there some kind of special monitoring? Should we be checking antibody levels? All things that I desperately want to know, and the FDA and the CDC has not been forthcoming yet. So Lee asks, considering that there are 112,000 people in Douglas County, but only those 12 and older eligible to be vaccinated, what's the adjusted denominator you use to calculate the vaccinated percentage? So those who've been listening here know that I've been an absolute bear about these numbers, because people have just thrown them out there without explaining them what they mean. And so there's a bunch of different numerators out there, like the people who've gotten one dose of vaccine, the people who are fully vaccinated plus 2 weeks, fully vaccinated with an mRNA vaccine. And then the denominators can be the whole population, those over 12, those over 16, those over 18. And so it's very, very confusing. So what we decided to do about 6 weeks ago was to use only 2 numbers. And the only 2 numbers we're using are the number that we collect locally of the people who are vaccinated over the age of 16 who have received 1 dose of vaccine. The reason we do that is the state used this metric for about 10 weeks now, and the feds have used a similar metric of those adults over 18. We use over 16, but over 18 who received 1 dose of vaccine. So remember, the federal goal was 70%. The Oregon goal was a little over that. The Oregon goal for each county was 65%. Using that number, the denominator of people over 16, the denominator for that is 94,000 people. 56.9% of people 16 and above have received 1 dose of vaccine. That's terrible. I mean, the rest of the country's at 70, and the rest of Oregon's at 70. We're at 56.9. We're still 13% lower, and that is counting in the VA and the Cow Creek and all those other doses, so we're low there. The one other number I would have you do is the number of people who are fully vaccinated, because remember, with the Delta, being fully vaccinated gives you the most protection over the entire population, which is 112, and that's 42%. Again, not surprising, because many of those people are kids who couldn't get vaccinated. So 2 numbers to remember: 56.9% of people 16 and above have received 1 dose of vaccine, and 42% of all residents are fully vaccinated. To get there, to get to herd immunity, you need to get to a much higher number. But then Lee goes on and says, shouldn't the numerator include all documented infections, confirmed COVID cases, and cases we assume are out there but are not tested and reported? In parentheses, surely there are many, many people who contracted COVID, but due to stigma or mild symptoms have just stayed home and toughed it out. So this is a complicated thing that we have been following, is something called seroprevalence. So you take blood from people, either when they donate blood, when they're in dialysis centers, or when they go to lab for something else, and you look to see what percent of those people have antibodies. Well, before the vaccine was out, we got this data, and we knew how many cases we had. So at a certain time, for example, we had 1.3% of the population having had the disease. At the same time, those seroprevalence studies suggested that about twice that number had antibodies. And while this is not perfect, it looks like we have picked up about half of the cases in the community. Some places have done much worse than that. So you could imagine, because New York City and Detroit had lots of cases early on when there wasn't a lot of testing, they only picked up maybe 1 in 5 cases. Some places picked up even less than that. But we think we're pretty sure that we've picked up about half the cases. You say, why did you pick up more? Well, some people were asymptomatic. Some people chose not to get tested. Some people had other things. But looking at those seroprevalence studies, we think we've picked up about half of the cases, which means that about 9,000 Douglas County residents have had the disease and would have antibodies. So we add the number of people who are vaccinated plus the 9,000 people who have the disease, we would have about 61,000. But you have to worry a little bit, because some of those 9,000 who had the disease have also had the vaccine, and you can't count them twice. So that's why we don't specifically do that number. But if you're really interested in the details, the state publishes every week a thing called the projections. And so if you go on the OHA website, you can find that. And it has what the natural immunity is. But if we have the natural immunity, plus we think we have about 60,000 people who have antibodies either from the vaccine or the disease. So 60,000 out of 112,000 people in the community. So the question is, what do you need to do to get to herd immunity? So herd immunity is overly talked about, but herd immunity means enough people are vaccinated that the disease really won't spread. And so, for example, with measles, once about 95% of the people in a community are immunized, case of measles could get introduced from a traveler or whatever else, but they tend not to spread because you tend to spread it, with measles, you tend to spread it to about 15 people. And so if the 15 people you would spread it to are all immunized, it's not going to spread. If of those 15 people you'd spread it to, only half are immunized, then 7.5 people will get the disease and they'll spread it on to others and others, and that's how it spreads. But once you're over 95% or so immune, you won't spread it more. And so there's a formula to figure it out for people who want to do that. It's 1 minus the reproductive number of the reproductive number. So when you figure it out, so with measles, it's 1 over 1. It's 1 over 1 over 1 minus 1 over 15, and that's where we get the 95%. Originally, this disease was thought to have an R value, or reproductive value, about 3.5. So 1 minus 1 over 3.5 would get this, why you were here at 60 or 70%. However, with the delta, it's 8. So the reproductive number is about 8. So it's 1 minus 1 over 8. So 1 over 8 is, going to be about 12%. So it's 100% minus 12% that don't need to be vaccinated, or about 85 or 90% of people need to be vaccinated to prevent this from spreading. So the story is that I think we're close to herd immunity. The answer is I don't think so. And in fact, we wouldn't have so many cases if we were close to herd immunity. There are probably places in the world that are close to herd immunity. So New York had a far higher level of background immunity because they had so many cases back in the springtime. But I think the data, and there's some recent reports suggesting that people say, oh, I think we're close to herd immunity. The answer is we don't think so. And you couldn't have 91 cases in Douglas County if we were anywhere close to herd immunity. But that's a great question, and there are really lots of computations and whatever that go into that. But again, it looks like it looks like maybe 9,000 Douglas County residents have had the disease and probably have some antibodies, and then we have the people who got the vaccine. They probably have antibodies. So not all of them, right? The vaccine doesn't take in everybody, and so I think we're far away from we need to have over 90,000 people with antibodies to reach herd immunity. So someone says from the hotline, I'm getting a lot of people asking why we're still having the fair and jamborees when we have so many cases right now. Yeah, this is a tough question, right? Everybody really looks forward to the Douglas County Fair, to the Arts Festival, to graffiti and whatever else, and so that's something we do worry about. Now, I will tell you that outdoor activities like the Arts Festival, outdoor activities like graffiti, are not associated with many cases of disease. And so we really, we think outdoor activities are an order of magnitude or 2 safer than indoor activities. So if I were going to curtail things, I certainly wouldn't curtail outdoor activities. First, I would curtail indoor activities. And, so we've consulted with the fair, and the fair is making some changes this year to decrease the number of indoor activities, to improve ventilation on the buses, all things that will decrease the risk. But people still want to do these things. However, the highest risk activities we're seeing in the last few weeks are workplaces. And the highest risk activity we're seeing is people going to work when they are sick. Every day we have a meeting every morning talking about the outbreaks, and the story we hear again and again and again, well, so-and-so was sick and they went to work for a few days and now everybody is sick. And the answer is, don't go to work when you're sick, because going to work when you're sick is the way you will spread it. So Gabrielle asks, with the number of people in the hospital higher than ever, I wonder how much space there is in there. So just met with Dr. Gray a few minutes ago, and Mercy's doing okay. They're keeping their head above water, but they have 8 or 9 people in the ICU with COVID. Remember, there's only 16 beds, so that doesn't leave very much space for people to get into car wrecks, have MIs or something else. So it's getting tight. Throughout the state, there are stories of people needing to wait in the emergency room to get a bed. Many of the hospitals in Portland are divert. Some are now stopping surgeries. And what worries me is that is that hospitalizations don't come on the first day of cases. So when you look at people get hospitalized, there's the occasional person who gets sick and gets hospitalized the next day, but overwhelmingly people get, say, infected on the 1st of August. The peak time of getting hospitalized is the 9th of August, so it's about a week later. We're now just a little over a week into the surge, and what I'm concerned about is all those cases we saw at the end of last week and over the weekend may by the end of the week do that. So I really worry about what's going to happen to hospitalizations in the next week or two. Similarly, we saw in Missouri and Arkansas when they had their big thing, Louisiana, they had their big increase in cases and they handled the hospitalizations pretty well until 2 or 3 weeks into the surge. Because what happens is those, as you have more and more cases, those people get admitted, but it's not like the people who are in the hospital before just all go home. Many of them are in the hospital for a fairly long time, and they use especially high intensity services. So these people are using PCU, progressive care unit, and ICU beds. They're using a lot of complicated stuff from respiratory therapists and ICU nurses. So it's not like any nurse could just work in the ICU. You really have to have lots of training experience to work in the ICU. And it's not like anybody can run the ventilators. These are complicated pieces of equipment. And then when you get to really high levels of care like ECMO, which is this basically heart-lung machine that you're on for days at a time, it takes a tremendous amount. And I think this is where hospitalizations are really struggling. So someone said, what is the case count and vaccination rate for kids 12 to 17-year-olds? Already breakdown of kids you have available. So you'll remember kids 12 to 17 can get the Pfizer vaccine. We've had about 1,000 kids in that age group get vaccinated. There are 5,000 kids in that age group, so it's only about 20% that have gotten that. We do know that there are a lot of cases in kids 12 to 17. Best we know that there have been no side effects from kids 12 to 17 who've gotten the vaccine. I saw a kid in the office today who I think was 12, and he had the disease. Mom reported that he was not terribly sick, but had like what was a bad case of mono, something you'd really want to prevent. So if someone is vaccinated and has exposure to a person with COVID, would they be required to quarantine? Right now, the recommendation is that if you are vaccinated and had exposure, you do not need to quarantine. That could change, but right now you would not need to. So Diana says, how can I tell the difference between COVID and a severe allergy attack? Is there a high rate of hay fever in the county right now? So Douglas County's got a very interesting pollen profile. We have in the springtime, typically between Easter and Memorial Day, a high tree pollen count. Starting on about Memorial Day through 4th of July, we have an extraordinarily high grass count. In fact, the grass count is frequently off the chart in Oregon, because Oregon grows most of the grass seed in the world because we have the perfect growing conditions for growing grass seed. That is a wet spring, so the stuff grows up, and then a dry summer, so that the grass seed is not ruined by that. So if you are allergic to trees, you typically have that time between Easter and Memorial Day, and if you're allergic to grasses, you then have it after. After the 4th of July, the thing that causes pollen is hay fever, which is usually ragweed. So for somebody who grew up on the East Coast where there's a lot of ragweed, you get a lot of symptoms starting after 4th of July through Labor Day or so, where you get hay fever caused by ragweed pollen. There is very little ragweed pollen in Oregon. Right now there's very little grass and there's very little trees, so the pollen counts in Oregon right now are pretty low. So people who are coming up with new bad allergies in August really need to be thinking that this is not bad allergies they're just coming up with. Now, I'm not saying it couldn't be, but I cannot tell you the number of these stories where we have outbreaks like, oh, so-and-so was sick and they went to work for 3 days thinking they just had a bad allergy attack. Well, did they have allergies before? Well, not really. The answer is you don't just develop allergies in August. So we really have to think that some of it is there. So how can you tell the difference between COVID and a severe allergy attack? It's hard, especially with the Delta variant. which has a lot of runny nose and a lot of sore throat, both symptoms you can see with allergy, they're really hard to tell. So if these allergies are new or different for you, I think I would assume it was COVID until proven otherwise. And get a test, and if the test is positive, then you've got it. Stay home. Don't expose your coworkers. And if it's negative, then it probably isn't. So the booster campaign will effectively turn Israel into a testing ground for a third dose before approval by the U.S. Food and Drug Administration. I think that is correct. As a doctor, can you give the third booster using your judgment? So this is a complicated answer. So the reason it's a complicated answer is that you remember the vaccines now are approved under an emergency use authorization. And there's a lot of stuff on the internet that says, well, nobody's responsible if there are problems. There really are. I mean, there is a fund by the feds called the Countermeasure Fund, and that protects the manufacturers from being sued and the doctors from being sued, and provides compensation for people who have injuries from the vaccine. So if I give a COVID vaccine to a patient or somebody else, and we follow the rules, we give Moderna or Pfizer or J&J according to the rules, and somebody's got a bad reaction, which they could have, doesn't happen very often, but could have. If the person has that and they try to sue the manufacturer or the hospital or me or whatever else, the Fed's saying, no, we said we would take care of it, and they have this special fund to go ahead and provide protection. To get that protection, I need to give it according to the rules, and the rules are that you're only supposed to give 2 doses and you're not supposed to give boosters. So if I say, oh yeah, you've gotten 2, let me give you a third booster, and then you have a reaction to the booster, presumably I do not get protection from doing that, and so people will be a little reluctant to do it. The other concern about sort of freelancing and giving this booster dose is we're not sure what the right answer is. If you've got 2 Modernas, is the right booster of Pfizer? Is the right booster J&J? Is there a sort of a time for the third booster? Are there some issues with the booster? And we do worry a little bit about that. You've heard about this myocarditis thing that happens after the mRNA vaccines, especially after the second dose. And the thought is that you get the second dose of the vaccine, and you get this, in the first few days, you get this really great immune response that helps protect you in the future. But the concern is now if you get a third dose, well, you get even a stronger response that could lead to even more myocarditis. So, for example, are we going to say, well, the people at risk for myocarditis are kids, so we shouldn't give a booster dose to people less than 50? And the answer is, I don't know the answers, and presumably somebody does, but I certainly hope that the FDA or the CDC comes out with guidance, because in the absence of guidance, people will freelance, and when they freelance, they will frequently get it wrong. So there was another question about ivermectin. You remember the last time we did this, there was stuff about ivermectin, and they said there are 50 studies. I've looked at the 50 studies, they're not very good, and so I asked them to do the one study that would convince me that ivermectin works. I will tell you that there was a very big, widely quoted study from Egypt that somebody looked at very carefully, and it was totally bogus. It was the introduction was copied, the data was all wrong, and like really wrong, not just like slightly wrong, it was totally wrong. And so that study has been retracted. Taking out that study, the data on ivermectin doesn't look very good. But again, I'm not saying it doesn't work, it does work or it doesn't work. The one good study that I know that I would give to you, if I was trying to say it didn't work, is a well-controlled study that showed it didn't work. But again, those people who want to do ivermectin, send me the one good and convincing study, and I'd be happy to look at it. So Gary says, does the government still cover the cost of treatment for COVID-related hospitalizations? If so, it seems like discontinuing this might be an incentive for getting vaccinated. That's going to be problematic, right? Because there's some people who are vaccinated will still get hospitalized, and we certainly don't want anybody going medically bankrupt because of the disease. What we've seen is that incentives to get vaccinated aren't really working that well. All these places have had lotteries, and the people typically who then get vaccinated are people who have gotten vaccinated anyway. So really what you're looking to do is find somebody who's on the fence and convince them to get vaccinated. incentives don't really seem to be that effective. Certainly a disincentive, like if you don't get vaccinated, well, we got rid of any help for people who did that. That seems cruel because there are people who are vaccinated who will still get sick. So Stephen says, can COVID be transmitted from drinking from a glass that an infected person just drank from? I don't know. We do not think this is transmitted much by the oral route. So some diseases are like mono, typically is oral secretions. Herpes, clearly oral secretions. We do not think that oral secretions are a major source. Now, could it possibly happen? Absolutely. And that's why I never drink from anybody else's cup. But we don't think that's the major source of spread. So somebody says there's a rumor going around that all of the hospital patients were vaccinated. So what's the story? Well, we look every day at the hospitalizations. We look every day at the people who are there. There is an occasional hospitalized person who's been vaccinated, but the overwhelming majority of our hospitalized cases, not just here in Douglas County, but in Bend, in Portland, in all the other places that look, are among the unvaccinated people. Now again, you remember that we're about 50-50 here in the county, and if the vaccines weren't working, you'd see sort of an even number of some. It is overwhelming majority of the hospitalized cases are people who have not been vaccinated. So please get vaccinated. So Tracy says, how many folks are estimated to have had COVID in the county? So we know about 4,600, and then we think we pick up about half the cases. And the question is, how do we know that it's half the cases? Because along the way, they've done these blood studies, seroprevalence studies among blood donors, among people who get dialysis, or among people who get blood work for other reasons. And they look to see what the level is. And when we've looked at that level, we found that we catch about half the cases. Nationally, we think we catch about 40% of the cases. But Douglas County, but that was because early on there were some counties that had such a big surge before we had testing. And so those people obviously didn't get tested, or it was really hard to get tested. It's not been particularly hard to get tested here in Douglas County. So we think we've picked about half the cases. So at 4,600 we know about, another 4,600 we don't know about 9,000 people. So those 9,000 people probably have some immunity. Although, as I said, it's not perfect. Some of those people who had disease are now getting infected for a second time. And some of those we know very well, right? So early on, we had somebody who got infected, went to New York to work as a nurse during their bad time, got the disease, got better. Months later, got the disease again. And there are a number of things in the literature where they've actually grown the virus the one time, grown it the second time. So it very clearly is secondary infections. But natural infection is okay. Natural immunity is okay. Not probably quite as good as the mRNA vaccines, but still okay. But to get natural immunity means you have to get the disease. And while many young people will get the disease and get over the disease, some won't. I mean, those 220-somethings and the 130-something in the ICU, I don't think any of them thought, oh, I'm going to get this disease, I'm going to wind up on a ventilator. So there's a lot of the stuff on TV, where people are on a ventilator and they always wake up and they do fine. That is not what it's like in real life. If you talk to anybody who's been on a ventilator for more than a little bit, it is a heart-wrenching experience. I mean, you're paralyzed for days, or in this case, weeks or months, with people who are days or weeks or months ventilated. These people are so weak when they get done. There was a guy this week who was on a ventilator for a while. He said, I was so weak afterwards. I couldn't wipe myself after I soiled myself. I couldn't feed myself. I was just that weak. And we've really seen that. So yeah, so I think natural immunity is okay, but we would really, really like not to have people get sick to get the natural immunity. And let's say we did this. Let's say we have 50 cases, we diagnose a day of 50 cases that don't have it. By the time everybody gets immunity, right, there's still another 50,000 people who need to get immunity. That's still a long, long time. So it's at 100 days, it's 500 days, that's a year of the amount of disease we've had every day for a year to get people with enough immunity. That's pretty hard. Okay, so here's a long thing. I'm not sure I can read the whole thing. So this is something that was sent to somebody, and sent to somebody else. So please take the politics out and read this with an open mind using common sense. And so I've seen a lot of those, but almost always when people talk about that, it's all about politics, and it really isn't about common sense. So it says, anyone out there who can tell me what our end game is with COVID-19, is it 0 cases? Why don't we just stop testing and stop reporting, and then the disease would be gone? Well, I can tell you, stop testing and stop reporting would not make the disease get gone. All of the people in the hospital now in the ICU would still be sick. They'd still be in the ICU, even if you stopped testing and you did that. So that doesn't seem to make a difference. So what is the end game with COVID-19? And the answer is, I don't know. We have never had a big epidemic or pandemic with a disease quite like COVID. And here's the problem with it. One is that there's very low level of previous immunity to this. So with flu, there are people who had similar kinds of flu a year ago, 5 years ago, 10 years ago, 20 years ago. So there is some natural immunity. Flu very much is a winter disease. You don't see very much flu in the summertime. And it's got a very short incubation period. You kind of know when you're sick, and you get it and you get over it. So flu is bad. This one is much more nasty. It's got a longer incubation period. It's got a lot of asymptomatic transmission, so you're transmitting before you know you're sick. And although the flu varies year by year, this is varying in the space of just a few weeks. So if you look, for example, at the variants in the UK, they had the ancestral form until about Thanksgiving or so, and then in a few weeks it was all the Alpha variant. And then they got done with them. And in a few weeks, it was all the Delta variant. We've never seen a disease that changes like that spreads. And it's a respiratory virus. So it's really hard to do. And it's got all these asymptomatic people. So what's the end game going to be? And the answer is, I don't know. But there are a couple of other countries that have sort of figured out an end game who have gotten back to regular life. So Taiwan, probably the best example. Taiwan, very populous. Off the island of China, a lot of travelers. They've used a lot of public health measures and vaccination. They have 0.1 cases per 100,000, which means would be 1 case a week in Douglas County. Bars, restaurants, things are open. They have concerts. They've used other public health measures and vaccination. So that's a possible end. The good use of public health measures and vaccination to get it down. South Korea, a very vibrant country. 3.3 cases. Norway, probably a better indicator of the U.S., down to 5 cases. Kids at school, businesses working, but they've used a combination of vaccines and public health measures. So we could get to a place where we have vaccines and public health measures, and if we could get our case down to a couple of cases a week, you'd never hear from me again about this. This would be kind of in our rear view mirror. You can't, when we have 91 cases, all of these businesses affected, 25 people in the hospital, 3 deaths a day, to say that, oh, we're just going to live with this. So what's the magic formula that's going to allow us to sound the all clear? The answer is there is no magic formula. As you know from this, there's not much magic. The only way that this will happen is we just stop testing and stop reporting. This will stop testing and stop reporting will not get rid of the disease. So is it a vaccine? Well, it took 25 years for chickenpox vaccine to be developed. Yes, it did. I don't know what that means. It took 9 months for this one to be developed. And this vaccine is far more effective and better studied than the chickenpox vaccine was. And then they say, kind of, I don't know where this comes from, the smallpox inoculation was discovered in 1796, and the last known natural case was in 1977. So it took 200 years to get rid of smallpox. Well, lots happened, and so we don't have to do what we were doing in 1796. So this goes on. There's 40 lines of this about what goes on. So there's something wrong here. It says we're not doing in-person school until the second quarter. No, the Oregon recommendation is that we start in-person school in September. So I understand COVID can be deadly or very dangerous for some people, but so are strawberries and so is shellfish. Okay. there are risks in the world here. I mean, we have talked about this for a long time, and there's lots of risks in the world, right? So swimming, driving your car, riding your bike, all of those things can be dangerous. And so what do? Well, to decrease our risk in cars, we have built very safe roads. We employ all these people called the police and the state police to go ahead and monitor what goes on, give you tickets if you speed. We have built all the safety into cars with seat belts and airbags. And so we try and reduce the risk. Do we reduce them to zero? Absolutely not. There are obviously some people who drive drunk, there's some people who speed, there's some people who don't wear seat belts, and yes, they can die. But for the rest of us who try not to die in car wrecks, there's a risk. But the risk is not the same. 600,000 people in this country have died of COVID. In a year, only 40,000 people die of car wrecks. So 15 times riskier to have COVID than it is to drive in a car. And yes, people can have allergic reactions to strawberries and shellfish. But again, we have hospitals and EpiPens and whatever to treat people who might have allergic reactions. And the number of people who die from those allergic reactions is very low. So again, we're not going to get the risk to zero. We're not going to say we can't do anything until there's not a case. But I don't think there's anyone out there who could say that 91 cases in Douglas County today is somehow acceptable. You know, we don't have 3 deaths every day from car wrecks. We know the dangers of smoking and we do it anyway. Well, yeah, the danger, we certainly spend a lot of time trying to get people not to smoke. But again, the relative risk is really different. So is hugging grandma really more dangerous than rush hour on the freeway? Well, so if you have COVID and grandma's not vaccinated, yes, it's far more dangerous than rush hour on the freeway. So, you know, your risk of dying in a car wreck is about 1 in 100,000 miles. Rush hour on the freeway, maybe, you know, a little bit of time on the freeway. Much, much, much more dangerous. Is going out with friends after work more risky than 4-day-old sushi? Yeah. How many people have you known who died from 4-day-old sushi? I know a bunch of people who died from COVID. So again, people are saying here, I don't want to be political, but this is all political, talking about freedoms versus what goes on. And again, our country is pretty open to freedom and letting people do it. But I think right now, when I see all these people in the hospital and these people who are dying, all of whom are unvaccinated, I'm sad, because these are deaths of people who could have been prevented by getting a vaccine. So I think the answer is, I would have people get the vaccine. I would have people be safe about what goes on, but I wouldn't say you have to be locked up in your house, or we can't have school, or we can't have the fair. What I would say is that we need to try and be as safe as possible. And the first thing we could do is get everybody vaccinated. The next thing we could do is stay home when you're sick. The third thing we could do is, when we're in a sort of a crowd, you'd wear a mask. Those 3 things. I don't think that's a huge infringement on your freedoms. I know people will disagree, but please. So this person ends with, after 50 lines, when God decides it's your time, you don't get any mulligans. So I guess I would rather spend my time enjoying and living in the moment and not worrying about the what ifs and maybes. And I bet I'm not the only one. I think I answered that. I mean, I think not only God also gave us the ability to make vaccines and make decisions which would protect others. And so I would say, do those things. Get vaccinated, stay home if you're sick, and if you're in a crowded place, wear a mask. So how can they determine the efficacy of the vaccines to the variant so fast? Thank you, Casey. So there are places that sequence almost every case. And so they sequence almost every case, and so they know which people have which disease, and then they can see that. So the US is only sequencing a few percent, so you really can't tell in the US. Although what we can tell in the US is that almost all the cases in Oregon now are Delta. So it was something like 63 of 65 sampled in the last week are Delta. So Deborah says, I heard today that Oregon was going to close down again. Any truth to this? Again, that's a political decision about closing down again. You'll remember when I asked you to do those three things, nothing was about closing down. The first is get a vaccine. The second is stay home if you're sick. And the third one is consider wearing a mask, but consider not mandating that you wear a mask. The problem with closing down is that there would be a lot of people who would say, screw that, I'm not going to do it. And that leads to all kinds of troubles and civil disobedience. So I always suggest that if you're going to make a rule and tell people to do things, that what you should tell them, that you should have a way to enforce that for people or not. So we have speed limits on the highways. And if you go 100 miles on the highway, sooner or later a state cop is going to come up behind you and get you a ticket. If we close down again and close restaurants and whatever, we have no good way to enforce that. So I don't think we're going to need to do this, but what I'm asking people is to do it again. So Ann says, are people who got COVID last year getting the Delta variant as a second COVID infection? Some. The national immunity seems to be pretty good, but not perfect. Should they get the vaccine even if they've had COVID? Absolutely. Lots of good studies suggesting that the very best immunity you can have is to get the national disease and then get the COVID vaccine. So yes, we would recommend that. So Teresa says, I tested positive for COVID and I'm fully vaccinated. After my quarantine, can I still get the disease or can I spread it? Again, nobody can say 100%. Nobody can say 100% one or another, but you are pretty well protected. So if you've already tested positive and you're fully vaccinated, you are pretty darn, you are pretty darn well protected. We do not think that, we think people with normal immune systems after 10 days can't spread any further, but you are pretty well protected. Can we do a mask mandate? Well, I think I answered that above. I can very strongly recommend, and we can give you as many masks as you want so you'll be able to wear them. But again, if we do a mandate, what are we going to do? I mean, I'm going to go out with a citation book and write to people, you must, here's a ticket for not wearing a mask. Certainly, we're not going to send our police officers out to do that. So with a mask mandate suggests that there's some consequence if you don't. So we're not going to go there. We're not going to go in this county with a mask mandate. But really, people should do it. I mean, if you're in a crowded area with people you don't know, you should do it. So I was in the clinic today, a lot of people around in the clinic. I wore my mask the whole time. When I go to a restaurant, I'll wear the mask until I sit down to eat. So again, I don't want to have to mandate it. I just want people to do it. So how many positive cases were vaccinated versus not vaccinated, just taking hospitalizations, just positive cases? So we have the world's best epidemiologist in Douglas County. I mean, she is incredible. And so Laura pulled this data for me. So if we look between January 1st of this year till July 31st, so up until right now, there were 3,000 cases in people who were not vaccinated, 127 cases among people who were fully vaccinated. So out of 3,185 cases, only 127 were among the fully vaccinated. So that's pretty good. If we look just in the last 2 months, which is where we think we had it, there were a total of 1,039 cases. 939 were not vaccinated and 100 were fully vaccinated. So we've looked at the vaccine effect and efficiency. It is about 70 to 80% to prevent you from getting an illness, about 90% to prevent you from being hospitalized. So not perfect. And again, the vaccines, and this is why we want people to get vaccinated early and keep the disease count low, because if enough people are not vaccinated, this disease is going to continue to spread and will bring more variants into the community. And as we bring more variants into the community, more and more, the vaccines will work less and less well. So, the vaccine, it was so great against the ancestral forms for which it was developed, still pretty good against the alpha variant, but got much less good against the beta and the gamma, and now less well against the delta. And that's why we want people to get vaccinated, to keep the disease count low. Right now, there's no way we could sequence all of the cases that we have now. All right, let's see what else we got here. So if 100% of the population were vaccinated, wouldn't the virus continue to be passed between individuals? I don't think so, right? If 100% of the population was vaccinated, we would have enough people vaccinated that even if somebody came in, traveled somewhere overseas or whatever, and brought it in, it just wouldn't have a place to go. You might see some small outbreaks, but certainly not the big outbreaks we've had before. So Jesse says, if somebody had COVID and gets it again, are symptoms just as bad the first time, or is there some immunity so it's not as severe? We've seen both. So there are a couple of cases in the literature where people got it the first time, were mildly sick, and actually were sicker the second time. But then we've seen other times where people were sicker the first time and less sick the second time. And so I don't think we can make any generalizations here. Can we go back to getting numbers Monday through Friday? Allison asks. I will check with, we collect the data every day. So we collect the data every day. The press releases only go out Monday, Wednesday, and Friday, but we'll check to see if we can go daily. Because it is shocking, when you get on Monday to see all the cases that happened over the weekend. So should or will Mercy follow the lead of hospitals in the state and require all healthcare workers to be vaccinated? And this is another thing we talked about at our 4 o'clock call today. Oregon has a quirky law that suggests that healthcare workers can't be required to be vaccinated. There was a story in the press today about Kaiser. I'm not sure how that's going to go. We might see something from the state on this in the next bit. So the story is require. Require means that I come down with force on the boss. They say, you will get vaccinated. I don't want to go there. I just want people to sign up and get vaccinated. I just want people to go and get vaccinated. I don't want to have to require or write tickets for people or whatever. Just get vaccinated. How can we control mutations by more people getting vaccinated? So the way mutations work is that mutations are a slight change in the genetic formula that then gets passed on and on if it makes the virus more likely to survive than others. So I've used this before, and if you've heard it before, you can go get a beer while I'm talking about this. But imagine we were at a cooking convention and people were writing down recipes. You got to taste what was going on there, and if you liked what they tasted, you got a copy of the recipe. They had to be handwritten. So after a while, people would make mistakes. So if you made a mistake in the recipe and spelled vanilla with 1 L rather than 2, it's sort of a nonsense mutation. It doesn't make any difference and really would affect what goes on. But let's say the recipe was for a pound cake and you put in a tablespoon, you miscopied a tablespoon of vanilla versus a teaspoon. The person tasted it and said, wow, that is much better than the original. What happens, that recipe would get circulated more and more. Similarly, if you had something that made it terrible, like add a pint of Tabasco, that would taste terrible and that would never go anywhere. So the rare mutation, which makes the virus fitter, tends to spread more. So with the Delta, it's got a bunch of mutations, but these bunch of mutations make it spread twice as good as the original one. Well, when it spreads twice as well, it's going to take over right away. And the best way to prevent mutations is to prevent the disease from spreading. So if the disease has nobody to spread it, it'll mutate, but it's going to mutate much less because the number of mutations depends upon how many cases there are. So when there are millions of cases in India, this is where you developed the mutations, and especially the Delta variant. So the best way to go ahead and control mutations is to control the spread of the disease. And you can control the spread of the disease by either vaccination or by public health measures. When you think of it, think of the places where these mutants have developed. The UK, tremendous amount of disease. South Africa, Brazil, India, all places with tremendous amount of disease. You haven't heard about the Australian variant or the Taiwanese variant or the South Korean variant because they've got very little disease, and with very little disease, they have very few mutations. My biggest concern is Africa, because there are a lot of people in a lot of crowded cities, some people with weakened immune systems, and we think that the mutations may be more prominent in people with weakened immune systems. Yeah. So should employers take more responsibility for making it easier for slightly ill folks to stay home or to get time off for vaccination? Yeah, many folks can't stay home unless they're very sick, and this is a big problem in our country, and it existed before COVID and exists now. Yeah, in the U.S. we don't have particularly good sick leave policies, and with no good sick leave policies, and many people living paycheck to paycheck, they can't take off 3 days when they got a little bit of a runny nose because it could be COVID, and this is a big problem. Yeah, this is one of the best things that employers could do. Say, look, during this time, if you're sick, please stay home. We'll figure out some way to deal with your PTO, but please stay home, because what happens is they come into a business and they can shut down the business. So we've had a couple of businesses here where people have gone into work and are really doing this. So there's one big employer in town that actually shut down a production line because of the disease. Okay, we're getting to 6:56. We'll go a few minutes here, and then what we'll do is we may come back on Friday to answer more questions. So what's the question about a mask mandated school? This is getting very political. I'm talking with the superintendents tomorrow, so I'll know more on Friday. So we know people who have COVID, so they have been isolating. However, they'll not get tested. Yeah. So if they call the hotline, we can help them with needs that they have. We would really like people to get tested so we know indeed people will have it. Jessica asked, do you see kids under 12 being eligible for vaccine anytime soon? We have heard that it's going to be later this year or early in 2022, but we don't really know. Amy says, can COVID cause platelets to rise? So platelets are those tiny little cell-like things in your blood that help you to clot. And platelets are one of the most fascinating things. I don't know, nuclei, they sort of have this sense of knowing where bleeding is happening. Platelets are one of the most interesting things in the body. Platelets can both fall and rise with illness. You'll remember with the J&J vaccine, there's a rare side effect that causes platelets to fall. With any illness, platelets are, so if your body is fighting any illness, your platelets will rise because your body sort of figures out that, hey, we might be needed, there's something going on here. So yes, COVID can cause platelets to stay the same, fall, or rise. So what are your thoughts on people saying that vaccinated people are sloughing off the virus, getting others sick? That's silly. You don't slough off the virus because you've been vaccinated. We do know that people vaccinated can get infected, and if they're infected, they can pass this on to other people. But you are not sloughing off the virus just because you got vaccinated. That I was listening to a podcast today that was just crazy. So which vaccine did I choose to take? Well, I was eligible early because I'm a healthcare provider, and I had my choice of Pfizer and Moderna because I was working at Aviva, had mostly Moderna type. I got Moderna, but I think at this point, I think I get the Moderna or the Pfizer. In our breakthroughs, J&J has been overrepresented in the breakthroughs. This is not shocking because remember, it's a single dose vaccine, and we knew it had lower levels of antibodies. So at this point, I would probably go with the Moderna or the Pfizer. We have tons of this. So Tracy says, what are the quarantine recommendations at this time? So quarantine means you've been exposed to a case, and we don't want you to get it and spread it to others. So if you're vaccinated, you don't have to quarantine, you can just self-monitoring. If you're not vaccinated, quarantine could be one of 3 ways. First is 14 days, staying home and quarantining. 14 days is pretty hard for people. It is the safest, but the longest. You can do 10 days of home quarantine and then self-monitor for symptoms for days 11 through 14. Or you can stay home for 7 days, get a test, and if that test is negative and you're asymptomatic, you can go back on the 8th day. So those are the three recommendations. So Christine says, did I say the Delta variant causes runny nose and sore throat for the vaccine? No, the Delta variant causes that for people who get the disease. So if you get so early on with the previous forms and with alpha, the predominant symptoms were fever, cough, loss of sense of smell and taste. Not very many of us as adults develop fevers, random fevers. It's really rare to get loss of sense of smell or taste. And so back with the other forms, you could kind of listen to the call and say, "Oh, that sounds like COVID. You can't smell the lavender in the room here. Ooh, that's a worry." With Delta, what we're seeing is that some people have fever, cough, and loss of smell or taste, but some of them only have a runny nose or a sore throat or a headache. So I did a bunch of calls this weekend, and there were a couple of people who had that. It wasn't related to whether they were vaccinated or not. It was related to infection with the Delta variant, which much more than the previous ones, only has sore throat, runny nose, and cough. Sore throat, runny nose, and headache in the first few days. After 4 or 5 days, they're all coughing and they have fever and whatever. But early on, so you can see how I don't really feel bad. I've just got a runny nose and a sore throat. I think I'm going to go to work today. And that's why we've seen a lot of spread at work, because people are working through their runny nose and their sore throat and yet giving it to other people. Extreme fatigue is there with all of the variants. And the extreme fatigue is really interesting. So I was talking to a mom today who had it, and she said, "I had it." And she said, "Oh, I was almost a little excited to have it in the beginning because I was going to be off work for 10 days and I thought this was going to be great because I would get a lot done." She said, "I was so tired, I could barely get out of bed. So I didn't get anything done." And the fatigue lasted for a while. And so extreme fatigue is common with all of the variants, including the ancestral forms and the Delta. All right, so I got through most of the questions that are here. We had 69 questions. So I got through most of the questions today. We'll see how many more questions come up through the week. And if we need to, we can do this again on Friday. Again, I really don't want to have lockdowns, mandates, citations, and whatever. What I want people to do is to choose for themselves what is the safe course. And I think, knowing a lot about this and spending a long time learning about it, I think the safest thing to do, get the vaccine. I think the other thing I would recommend is, if you're sick, stay home. And stay home for a day or two. If you're, for the second day, if you're still sick, get a test. There's lots of places to get tests. Get a test. If you're positive, then continue to stay home and bless yourself for not having infected others. If after on the second day of symptoms, if you test negative, you probably don't have it, you can go back to work. And then the third one is, if you're in a crowded area or an area where you don't know that please wear a mask. Masks aren't perfect. Masks clearly are not masks by themselves won't do this. It's going to take a combination of all of those things. So getting vaccinated, staying home when you're sick, and wearing a mask in a crowded place. I think overall, I know tempers are high and there's been a lot of negative stuff, but I've really been impressed by how nice people have been in general in Douglas County. And that's one of the reasons I really like living here. So what I'm saying is, be safe, be kind, and if we have a lot more questions, we'll do it on Friday. If not, we'll do it again next Tuesday. Again, this is Dr. Bob Dannenhoffer, Public Health Officer, Douglas County. Thank you.